Hello, I'm Donald Macaulay and welcome to medicsvoices.com, where we talk to the key opinion leaders in health and medicine around the world. Today we're talking to Rebecca Robinson, who's actually in Milan with a sports team, but is usually in the UK. Rebecca, you're one of the new generation of sport and exercise medicine consultants. Tell us about your career trajectory to date.
Yeah, I guess new in terms of when I started my training, that curriculum for sports and exercise medicine was in its probably one of its first iterations right then, back in 2010. And I went through that training as previously like a hospital trained doctor, and then moved into sport and exercise, really with the aim of what I still work in primarily, which is looking at frailty and exercising cancer, and also exercising female athlete health. And as you mentioned this week, yes, I'm abroad with sport, because obviously the job does also involve working with sports teams and keeping people healthy right up to competition.
Now, let me bring me back to ask you about your work on cancer. Your work on cancer is really interesting because you've done some work on people being active after their diagnosis of cancer. Tell us about that.
Yeah, my work in cancer is, I guess, a passion. I guess it's something that was like an inclination that this would be important from when I was working in hospitals with patients who are affected by cancer. And as I've been working as a clinician, a lot of the research has basically grown up around this area, and it's still growing. I think it was the common perception that people with cancer would not really be able to maintain fitness and muscle mass. We talk of cachexia, which is kind of wasting process driven by the metabolism during cancer, and sarcopenia, which means loss of muscle mass. But it looks like some of these processes can really be attenuated. So if we still have good nutrition, if we can manage that, and even a smaller amount of activity, it can really help to keep someone less frail, more resilient through their cancer journey. And from the evidence that we have so far, it does look like in some cancers, particularly around colorectal and breast cancer, that it may have a beneficial effect on recurrence, so it can reduce recurrence and may also impact survival. But I think the bigger message perhaps is that by keeping people resilient during and after their treatment, we can also hope to reduce some of the secondary effects, such as, for example, the cardiotoxicity of medications. So it's certainly a growing field, but there's an awful lot to be done still.
Give us some practical examples. What advice would you give to particular patients?
I think for patients, it's a case of working out what they were doing before and what they enjoy. So I have some patients who've never really been particularly physically active. They've had quite demanding jobs and lifestyles where they're looking after maybe the generation older than them and the generations younger than them. So they haven't really had access to being active. So I think for those patients, it's a case of finding out what they could enjoy, how they can access moving a little, some of their fears around physical activity, which may be related to their worries about cancer. So sometimes it's just getting people off the first rung of that ladder. So basically, I like to try and find out what people enjoy doing. So for some people who've not really had a history of being very physically active, it's trying to find out what they might enjoy, who they might go with, what is within their understanding of exercise and what they have access to. Because if they've got a diagnosis of cancer, you don't want to make people feel it's punitive or that they've got to do something that they don't enjoy or isn't actually feasible for them. And then on the other side, I have some patients who are very, very highly physically active. And sometimes it's a case of us looking at their normal level of physical activity, which can be quite a lot if they're a triathlete or a cyclist or a swimmer, and saying, well, actually, this is going to be a bit different right now, because sometimes they're going to have chemotherapy or surgery, and it might be really hard for them to alter like their normal goals around being active. But we're kind of looking at framing this as a period of time where their health comes first, but then not losing sight of the things that they still want to be doing. So I think I learned an awful lot from those patients, both groups of patients, those for whom we suddenly find physical activity and they can find something that they really enjoy, they didn't have before, but also from those who continue being active through their treatment. And sometimes medically you can say, well, I'm not so sure if, like how we'll do this, but we can kind of come to a plan between the patient and myself, and sometimes other members of the team as well.
Now, there's another group of athletes, and we shouldn't call them patients, and they're the female athletes. You have a particular interest in the female athlete.
Yeah, I think as a female athlete myself, as well as a medic, I didn't really think there was an awful lot that we didn't realize or didn't learn or know about, but there is. I think the more that women have come into sport, the more we realize that, you know, having a menstrual cycle, for example, is not an illness in itself, but it can certainly have dysfunctional symptoms and syndromes around it that we really need to be on top of in order that the female athlete can have as much availability on the pitch, in the gym, on the track, as the male athletes. And then we have other issues around that hormonal lifespan that are kind of different for a woman, such as considering a pregnancy, return to sport afterwards, looking at the menopause. So there are some different aspects around the fluctuations in a woman's menstrual life and general health and fitness to men. So I think it's become an interesting area that's still growing. And I think we're all still learning about it too. So there's been a really interesting part of my work as well.
Now, as one of the new generation of sport and exercise medicine consultants, I'm sure you're often asked about people who want to take up that specialty. What's your advice to them?
I think go for it is usually my advice. I'd say that it's a career in which you can make it how you want to work it. I still work very much in a portfolio job, and I'm really hoping that the balance of my job will be more in exercise medicine over the coming years. I think it's hard work to shape it. The generation before me, those that kind of like were the founders of sport exercise medicine, they really paved the way. And I think every time I think, oh gosh, it's quite hard because certain aspects of the work that I do are not embedded, I think, well, hang on, the others worked really hard to set this up, so I can't rest on my laurels. You've got to have that energy and drive, and sometimes you can feel a little bit isolated. So I'd probably say as well, talk to other people that do the job, because we can all share some of the frustrations as well as the successes.
Finally, let me ask you about your own sporting career, because you've been a top class marathon runner and hill runner.
Most of my fastest running was when I was a junior doctor as well, so I certainly didn't particularly protect the time around it. I guess I was just doing all the things at once. But yeah, I've been lucky to run the marathon for GB and on the mountains too. And I think it's definitely helped me around the understanding of what the demands are on elite athletes, but all level of athletes. And even some of the people that I work with who haven't done physical activity before, I'll say, you know, we have to maybe do some training because we think it'll have an impact on their illness, but we know that it can be fun as well. The balance of fitting it in is sometimes challenging, especially if I manage to get injured, which I've done a couple of times. But I think, you know, getting that mix into a busy life is really essential for me.
Well, it's certainly a busy life. You're talking to us from Milan today. Give us a flavour of where else you've been in the last 12 months.
Yeah. So it sounds exotic over here, but actually we're sort of mostly in a boxing gym. But I've also worked quite a bit with tennis. So managed to be in the Eastbourne tennis competition, which is not overseas, but a lot of international athletes, and also working with cricket. So not particularly a follower of cricket hugely, although massively respect the sport and love working with the athletes. But because Manchester Originals, the 100 team from the Northwest, we managed to get to Lords and the Oval within 24 hours last summer. So we're hoping to repeat that this year and go all of the way. So definitely some eclectic experiences there.
Rebecca, it's been a pleasure talking to you today. Thank you very much for joining us. May I wish you every success with your continued career, sport and exercise medicine, and on the road.
Thank you very much. Thank you very much for inviting me. Thank you.